Hi, everyone, and welcome to our webinar, Untethered Charting within NextGen Mobile. So before we get started on today's webinar, I have a few just housekeeping items that I want to take care of. So first, I want to mention that this webinar will be recorded. So we will be sending out a copy of this slide deck as well as that recording, and you should expect that within the next week. Next, I did want to mention some upcoming webinars that we have that you might be interested in. So on Wednesday, March 15th, Lindsay Lanning and her team will be sharing some of their lessons learned from, they have many years of experience with navigating MIP submission. So you can walk away from that webinar with, those tools to navigate that submission process. If you've gone through this in the past, they're also going to identify some new portal features that will make submitting that data even easier than it was before. Then we also have on March 23rd, we'll be presenting a brief live demo of our ChartGuard solution, which allows your practice to access your patient records even during a system outage. So you really can continue to see your patients with minimal disruption. And we are continuously adding new webinars across all of our areas of expertise. So you can follow us on LinkedIn. We post our webinar announcements, and also look out for the email invitations, which go out a week before each webinar. Okay, so we have a lot of ground to cover. So now back to today's webinar, which is Untethered Charting in NextGen Mobile. At the end of this presentation, we are going to open up the floor for questions from you. We'll answer all the questions that I can at the end. Like I said, we have a lot that I want to get covered, so I'll do my best to give you as much question time at the end. But you can type those into the questions area of the webinar control panel, just whenever they come to you, and then, like I said, we'll answer them at the end. And then finally, for audio clarity purposes, everyone's phone is going to remain muted throughout the entire webinar. Okay, so before we go any further, I did want to take a moment to introduce myself. So my name is Lexi DeMarsh. I'm the Consulting Development Manager, and I'm very excited to be your presenter today and to walk you through all things NextGen Mobile. All right, so let's jump right in to what you all actually came here for today. So I'm hoping that you will walk away from today's webinar, just have a better understanding of the NextGen Mobile application, how it can help your providers kind of break away from, really being tied down to a desk, to access patient data and then even complete some documentation. Okay, so I want to start with some of the basics of the NextGen Mobile application and some of the functionality available. So if you're not familiar, just so we're all kind of starting on the same page here, NextGen Mobile, it's an application that allows clinical staff to access key parts of the NextGen software. Really, anywhere that they have access to a mobile device, they can access the features that we're about to go over. I did want to note the mobile app is HIPAA compliant. So obviously that's very important when we're talking about patient data. So there are multiple layers of protection involving the app to help make sure your patient's data is secure. Mobile is compatible with many Apple and Android devices. So this is going to include both cell phones as well as tablets. So that really does open up, the possibilities for incorporating this app, into different workflows within your practice. There have been many, strides made in the past few years to improve kind of the scalability. So when you're looking at mobile on a cell phone versus a tablet, so it really is, kind of seamless to use it regardless of, the method that's being accessed. So there are two tiers, that are available for mobile. So you have the complimentary version. It's called NextGen Mobile, and then there's the Mobile Plus. This does require a separate subscription. So today in this webinar, we're going to be focusing on both options, and I will make sure to note if a feature is part of that base mobile application, or if it does require Mobile Plus. All right, so as I just mentioned, there are the two tiers available to mobile. So here you can see kind of a breakdown of, we have all the options available in complimentary, and then the Mobile Plus includes all of those with some additional functionality as well. So I kind of just use this. So when you get the slide deck, you have this just kind of reference. So let's take a look at each of these features and what they could look like for your practice. All right, so we're going to start by taking a look at how you can navigate within the mobile app. So when logged into the mobile app at the bottom, there's going to be a menu bar. This makes it pretty simple, to get around in the application. The first button that we have at the first view is called the hub. So this hub is what's going to be the main landing page. So when users, open the application, they can kind of navigate through some of those commonly used features. The next view is schedule. So this schedule view will allow for displaying the daily schedule for selected resources. The third view is messages. So messages is going to allow a mobile user to send and receive secure messages. This can be with other NextGen Mobile users. You even have the ability to bring in external users. So we'll kind of dive into what that looks like. And then that final view in this menu bar is settings. That's going to give the user the option to kind of customize their NextGen Mobile app. So let's dive deeper into each of these views and see how you can really use these to make your providers more productive. Okay, so as I mentioned, that hub, which we're seeing here, that's the first screen that's visible when a user logs into the mobile app. And this landing page is going to include sections for some of those commonly used areas of the application. So the job section, which is shown first here, is going to show a list of both current and past dictation jobs. So we'll dive a little deeper into the dictation options. Those can be accessed here. The PAQ, that's going to give a provider access to that provider approval queue that they see within the EHR. So they can really manage, see the pending items, and actually take care of those on the go. Medication tasks, that's going to provide a list of e-prescribing tasks. So things like, renewal requests, if they have pharmacy communications that they need to handle. Then our task section gives access to the provider's assigned EHR tasks. And then finally in this view, the charges section is going to allow, with the use of Mobile Plus, the entry and viewing of charges related to a patient visit. So I did want to note that this hub view is customizable, so it depends on the individual user and what they want to see and the order in which they want to see them. So they can click that edit button in the top right corner if they want to modify what they see here. So, really a key component to a provider's ability to, kind of serve their patients if they're not physically in the practice or not right next to a computer, after hours, rounding at the hospital. You can probably think of a lot of scenarios. It really is the ability to access a patient's chart, to be able to view that clinical data. So this can be accomplished in NextGen Mobile through the patient details window that we're seeing here. So this patient details information, includes things such as the patient's picture to help identify the patient that's being referred to or they're looking at. We can see demographics and then, of course, clinical data. So we can access this patient details view from a couple of places. So we can get there from the hub, so that main landing page. We can get there from within a schedule. So if we're looking at, appointments, we can also get there from within messages. So if we're looking at a message referencing a certain patient, we can actually click on the picture to view these patient details. So this data that is listed here is pulled real time from the EHR. And I did want to point out, with some exceptions, that most of this is not editable. So it's really just a view-only mode, like, for example, allergies, to be able to quickly pop in and see that information. There are some caveats to that we'll go over later. So this really allows, the latest and the most accurate information is being shown here, both in the mobile app and the EHR. So a user will be able to also see from this view patient alerts that were configured in the EHR. So, you can think of any kind of alert that would be, especially important to be able to see, for example, the patient's pregnant or something like that, potentially drug seeking if it's a prescription that you're managing. Those, if they are set to pop up for acknowledgement in the EHR, you'll have that same functionality here in mobile, as well as they can see any other alerts in this view as well. So the clinical information in this patient details is divided really into two tabs here. So the first tab is the face sheet. That face sheet really groups together patient data into several categories. All those categories can then be expanded on by clicking on those plus signs that you see to the left. So the first category is demographics. This is going to show patient information, things like the patient's address, phone number, if there's a referring physician associated with this patient, their primary care physician, that kind of information, that base demographics for a patient. The second category is medications. So this is going to show all of the patient's active medications, and then also allows for new medications to be prescribed from this view. We will also have categories that will show you things like the patient's allergies, charges. This is a feature that requires Mobile Plus to view those and then also to be able to enter new charges. We can see the patient's problems list, their past medical and surgical history, their last HPIs, lab results, as well as vitals. So in addition to the information on that face sheet, the second tab, this patient details view, is going to show documents and images in the patient's chart. So if a practice is using the dictation feature, which we'll go more in depth later on in the webinar, this tab is also going to include dictation documents. So if you have multiple types of documents available for a patient, they will be color-coded, so you can easily see the type of document that you're looking at. So for example, the orange EHR icon, that's going to let you know that document lives in the EHR. A blue chat bubble icon will let you know that that was a NextGen Mobile dictation document. So we can quickly see that here to differentiate between those. If any of these documents are associated with sensitive encounters, they will be marked as sensitive, as you can see here in the screenshot. So you can quickly see that before the decision if this information were to be shared. So documents can be shared with other users, so using that secure messaging feature. And they can also be searched within the NextGen mobile apps if you're looking for a particular document. And you can do that by swiping down to reveal our search and filter options. Speaking of searching, that feature is not exclusive just to documents. A search can be performed really from any screen within the NextGen mobile app. So it's done in the same method, just by swiping down from the top of that screen. This search can really be used to find pretty much anything. We can find a particular patient's profile. We can find dictation jobs if you're using that functionality, a list of appointments, messages related to that patient, or just messages in general with keywords, PAQ items, charges, things like that. So really anything within the mobile application. In addition, if the data is not found on that initial search, so it's not found within the data within mobile, you can click the continue search on server option there. And that's actually going to query the EHR application to pull any data. So if it might not have been captured in that initial search, for example, like a certain patient or appointment, you can click that continue search and you should be able to find the data that you need. So in addition to viewing that patient's clinical information, providers can also use the mobile app to manage medications and even e-prescribe. So requests for new prescriptions and refills is also a quick task that providers might need to fire off, so that can be completed from the mobile app as well. So from the patient details view, the user would expand the medications panel in order to view, prescribe, or renew their medications. By default, when a provider is looking at this view, they're only going to see active medications displayed. If a user does want to see inactive medications as well, they have the ability to toggle that filter off to see a full picture of medications. From this window, a provider can click the renew option to quickly renew the medication for a patient, similar to like in the EHR. They can make any modifications as needed before sending the prescription if that's required as well. Clicking view edit is also going to show additional medication details and allow for any changes there as well if needed. And also with the latest version of mobile, e-prescribing of controlled substances is now available. That's pretty neat to add one more thing that's available. This is going to require the EPCS two-factor authentication. So, the similar options we see in the EHR, like, semantic VIP or Identitrust, it's really going to follow the same processes if you were e-prescribing a controlled substance from the EHR. So the whole configuration process for that two-factor authentication, the rights that are associated with it, that is still going to live in the EHR. It'll just apply for mobile as well. In addition, to accommodate for, many states now require that a PDMP check be completed prior to e-prescribing controlled substances. There is now a new View PDMP link that is available, and it's going to pull that same report that we would see in the medication module if we were to run the PDMP check. And then finally, also in this latest version of mobile, the formulary search can be used when appropriate. So, as you may be aware, a key component of being able to use that formulary search is the requirement that the RX eligibility functionality, it's a mouthful, needs to be configured and ran. So that is now included in the workflow when applicable when searching for medications within the mobile app as well to accommodate that. So to prescribe a new medication within the mobile app, the provider would click that new medication link that we saw on the previous screen. Much like, in the EHR, if they're prescribing, that medication that is needed can be found, by searching, by keyword. We can use medication favorites list within the mobile app as well. And then we can tap on that encounter that's listed up at the top of this screenshot. That will allow the user to select a different encounter to associate that prescription with if needed. It is important to note that when prescribing in the mobile app, if there are no unlocked encounters available to be used, a new billable encounter will be created automatically to allow that prescription to be entered. After the medication has been selected, the patient's default pharmacy will also be available for selection. So you can use those defaults, or if a default pharmacy is not configured for this patient, or if they just want to be sent to a different pharmacy, you can perform a search, much like we would see, in the medication module in the EHR. So in addition to prescribing new medications, providers may also need to manage, their medication refill requests. And it's an added benefit to be able to do that, without having to go into the NextGen application on the computer. So the hub, remember that main landing page within the application has that medication task category. So that's going to display a list of all of the pending refill tasks that the provider has. Those tasks are going to be automatically sorted by oldest to newest, but that default order can be, reversed as needed. The provider can select a refill from the list. They can review the details of that request. Once that request has been reviewed, the provider has the option to either select approve, to accept that refill and have it sent through, or they can select deny. And similar to like in the EHR, if they are denying the refill request, they'll be prompted to enter that denial reason. So the process for submitting a new controlled substance prescription, it's initially very similar, to what we saw with prescribing a non-controlled substance medication. But once that, prescription detail has been entered, similar to like in the medication module in the EHR, the provider is going to be prompted with this RX verification window. So this will walk them through, those typical steps for that, necessary two-factor authentication to verify the provider's identity. So, just like in the EHR, it will initially ask for the provider's NextGen username and password, and then followed by the authentication token that you have set up for this provider. The rules, which substances can be renewed and by whom, are the same for mobile as they are within the EHR. So renewals within mobile cannot be submitted for DEA class C1 and C2 medications. And then additionally, prescribing delegates that have the EPCS permission, but they don't have a relationship of self and system administrator, they are able to renew controlled substances, but not prescribe them initially. So again, those rules are similar to what's in the EHR. They apply for mobile as well. Another important aspect, really keeping your practice and providers productive, not in the office, is to ensure that those clinical tasks in their inbox are reviewed. So that's something that we can accomplish here in our mobile app. So our task list is available from the hub, so from that main landing page. It really allows providers to easily see a list of clinical tasks that have been sent to themselves or even a work group that they belong to. So along with just viewing those tasks that they have assigned, providers can manage the task list. The same options we see in the EHR. They can reply to the task sender. They can forward a task. They can reject a task, mark it as complete. And then from a task, a provider can also open a patient's chart, view clinical details as needed. Any tasks in the list that have not been accepted yet by this provider that's logged in are going to be shown in bold, so it kind of just quickly shows you what hasn't been addressed yet. And to kind of bring those tasks that probably need attention first, so typically are the oldest or high priority. This list is defaulted first by priority, so those high are going to be at the top, and then by due date. So in addition to viewing those tasks, this mobile app can also be used to create new tasks that will then be sent to the EHR. So similar to the options that we would see if we were creating a task in the EHR application, a user can associate a task with a patient. So if they're referring to a particular patient, maybe asking someone else to call the patient, we can associate the patient by clicking on the image there with a face and a plus sign. Once that patient has been attached to the task, a paperclip icon will show on the new task window. And again, similar to in the EHR, that will allow for attaching of documents or images from the patient's chart. And as a note, similar to like in the EHR inbox, lab orders can only be attached to tasks from the PAQ. So I just wanted to point that out, that works the same as it does within the EHR. Once that, if the patient has been selected any documents, clicking in that to field on the screen will allow, a user or work group or multiple users, multiple work groups to be added to the recipients list. The user can then, update the due date as needed, assign a priority, and then finally add any task comments that need to be associated with this task. So another important aspect, keeping your providers productive is to ensure that provider approval queue are frequently checked and managed. As I'm sure some of you have probably experienced, this can be an area that can really get out of hand if it's not kept up with and reviewed regularly. So being able to do this really from wherever is in my opinion, really huge added benefit. So from that hub in the mobile app, a provider can quickly see how many pending items they have in the PAQ that need their attention. So they'll see all pending items. Those would be documents, images, order results, scanned items, crystal reports. So from that PAQ view, a provider can filter by item type if they would like to, hone down, maybe start with just the orders first, crystal reports, whatever the case may be. And then they can also choose how their items are then sorted in that list. So by default, the items are sorted by the newest first, but that can be reversed. So if they did want to go back and address some older items initially, they have the ability to modify those filter options. So for a provider to review a pending PAQ item, they would just click on that item from the list. This is going to show them, as you can see here, a preview of the items, whether it be the document, image, order result, anything like that. They can view that here like they would in the EHR. At the bottom of the screen, there are going to be several buttons for the different PAQ items, so different actions that they can take. So if a provider has any PAQ rules configured in the EHR, For example, it's send a task when signing off on an order result. Those rules will take place in the mobile app as they would in the EHR. So we have our sign-off options. If a provider needs to reject a document or image, similar to like in the EHR, they would click that reject, and they will be prompted to enter a rejection reason. Providers will also have the ability to reassign PAQ items. So if something ended up in their queue in error, then when they click that reassign, they'll be given a list of other PAQ resources, and they can choose to redirect that item, just like in the EHR. If any PAQ comments need to be added, tapping that comment icon is going to allow them, they can add any sign-off comments, and they can also view previously added comments if there are any. And then finally, we have our new task button. So that will allow a provider to create a task. So based on the item that they are reviewing, if they need to task that to someone, they can do that from this view. So in addition to what we've already discussed, a relatively newer feature in mobile that's pretty neat is the ability to scan documents from a mobile device that will then go into the patient's chart. So using the NextGen Mobile application, so a user can use their mobile device, as I mentioned. They can use that camera to then take a picture and kind of scan that item to go into the patient's chart. That scanned document is saved as a PDF, and then part of that scanning process will be assigning a document type. So I did want to note that this does require that a user has the security rights in both system admin and file maintenance to access the different document types for filing. So they go through a similar process. If they have a consent form and they're taking a picture on their phone, then if they have the rights to be able to file it as a consent, they can do that. Up to 10 pages can be added per document. And then once those pages have been scanned, the user does have the ability to make some edits, rotate pages. They can remove pages as needed, if there are duplicates or ones that aren't needed, as well as add additional pages. So if they want to continue scanning into one job, and then they can go ahead and file those. And like I mentioned, those will show in our patient's chart like any other scanned document would. So another feature that is very neat within mobile that's beneficial is the ability for a provider to keep on top of that daily schedule. If they're running back and forth maybe from the hospital to the office, or if they're at home conducting virtual visits, that can be a challenge just to keep on top of those schedules. So the schedule view in the NextGen mobile app can really make it simple to see not only upcoming appointments, but they can even see when patients have been checked in. Let's take a look at what that would look like. So the schedule within the mobile app is real time, so it's continuously going to be updated. If appointments are added on, canceled, patients checked in, things like that. So for each appointment, a user can quickly see things like the patient's name, the MRN, the appointment time, appointment reason, location of the appointment, and then depending on the device, whether it's Apple or Android, a provider can either swipe left on an appointment or press and hold, and that's going to reveal a more details button. That's going to allow the user to see even more information, so things like that appointment description, the duration, if the appointment was confirmed or not, so just some additional information that might be helpful. We also have, in addition to that base schedule information, we'll have several check-in indicators, and that's going to show some additional detail. So the first is a green circle, which that indicates just a traditional, in-person visit, and the patient has been checked in. If the practice utilizes the virtual visits platform, the indicator will be a green camera icon. So clicking on that icon is going to actually allow the provider to see when the patient is checked in, but also actually start that virtual visit from their mobile device. A provider might also see a green person icon if the SCRIBE functionality within mobile is being used. So we'll talk about that live SCRIBE a little bit later on, but this allows the provider then to see that the live SCRIBE is being used for this visit and actually initiate that visit with the patient and the SCRIBE involved. If a user would like to see multiple schedules at one time, so, it's pretty common within the EHR, maybe to see it yourself if they've another schedule that they want to see as well. They can click that resource link at the top of the schedule screen. And then if multiple resources have been selected, those patient appointments will be color-coded, so based on the colors that are shown here. And that can just help identify which schedule they belong to quickly if viewing more than one. Mobile users also have the ability to incorporate phone calendars into the patient schedule. So this can be a personal iPhone calendar, a calendar to show U.S. holidays. If there's within your practice you have a shared like Google Calendar or Outlook or something like that that would be helpful to incorporate those maybe for meetings, time off, things like that. You can actually incorporate that into the mobile schedule. You can kind of see it all in one place. So that's done under the settings icon. And then any of those calendars that are synced that are outside of the really appointment calendars will display in gray on the schedule. So you can just easily distinguish that that is not, a patient visit versus, a personal appointment. So in addition, if your providers at your practice are really spread out among several locations, or seeing patients virtually at home, it can be kind of difficult sometimes to manage communication among providers and staff that really while keeping it secure. So sharing that patient data, as I'm sure you're aware, over just normal text messaging or email can really open up your practice to additional liability. So to address that, there's a feature in NextGen Mobile, and that is secure messaging. So with secure messaging, your clinical staff, can not only communicate with other mobile users within the organization, they can also even send secure invites to a conversation to users that don't have the mobile app. So, for example, maybe if they are working with a provider for a referral and they want to communicate about the patient, they can do that by sending an invitation from the mobile app. That user will then, or that I shouldn't say user, it's not part of the NextGen, that person will receive an invite to download the app, and then they would only be given access to very limited information. It would just be the information that that person is choosing to share, so typically just related to that patient. From that messages icon on the menu bar, when they first log in on that hub, a user can start a new conversation, as well as also manage existing ones. Within a secure message, in addition to text messages, users can also send audio clips, photos, documents, and face sheets, which is just kind of like a summary of the patient's, information, similar to that face sheet view on the patient profile we just looked at. That can also be sent for external contacts. Back to the example of maybe you're communicating with a provider, you're sending a referral, so they don't have the full access to NextGen and all of your data. You can choose to share that as a face sheet if you'd like to. If a provider would like to save a secure message to the patient's chart, so again, maybe you're conversing back and forth, or even with another provider within the practice regarding the patient or their care, you have the option to save that. It allows you to create a document with that saved information within the mobile app, and then that is sent to the EHR. So sending a secure message within the app is, really is similar to sending a text message from your cell phone. From that message view, the user would select the paper and pencil icon to start a new message. Then they would be prompted to select one or more contacts to add to the conversation. So again, just like a normal text message, it can just be one-on-one. You can invite multiple people to collaborate on this message. Next, if they would like to associate a patient with the subject of this message, so it's specific to a patient, they can associate that patient's record. If a patient isn't selected, so if it's maybe more of a generic chat, it's not revolving just around one patient, you can add a group name, and that can help to differentiate this message string from others. As I mentioned on the previous slide, in addition to just typing those messages back and forth, a user can click and hold the microphone icon if they want to send an audio clip. They can also send photos, documents, or as I mentioned, that patient face sheet. That can be done by clicking the share button, which is that icon with the arrow to the left of that text field. Something I did want to note about photos that are captured through the mobile app is they are not stored directly on the actual device that you're using. So if that's a personal cell phone or a tablet, and you can't add photos to a chat from your phone's own photo library. So that's just, when I mentioned this is all HIPAA compliant, that's another layer to make sure that those messages are solely living within the mobile app and not on, a personal device. So the next few features that we are going to review today, as part of this webinar, are going to focus on the Mobile Plus tier. So this tier kind of goes beyond the base application and the features that we reviewed so far today, kind of gives you additional functionality. So the first Mobile Plus feature that we're going to look at is charge capture. So charge capture is going to allow a provider to both review and then also enter charges for a patient, from anywhere they have that mobile device. Depending on your practice's workflows and your desired configuration, those charges can either go directly to the EHR, and then they would go through the normal process after that if you use the holding tank, or they can also go to what's called the mobile cloud portal for review. So we'll talk about that a little more at the end of the webinar. Charges that are sent to the EHR, those will flow into the PM application, following that normal workflow. If you would rather those charges be reviewed prior to making it to the EHR, you can enable the cloud portal, and that kind of acts like an additional holding tank for those charges. So it just kind of depends on the needs of your practice. I did want to point out that there are two scenarios where those charges will automatically go to the cloud portal, so regardless of how you have it set up. The first is if the provider is entering charges and selects a patient without an open encounter. So as you can imagine, if there's nowhere to put those charges currently, no open encounters, then that will go to the cloud portal. The second would be during the charge entry process, if the provider chooses to attach an image or any comments along with the charges, those will need to be reviewed in the cloud portal before they make it to the EHR. And then in addition to adding those new charges, as I mentioned, a provider can also review charges, and that will be for up to the past 7 days for a patient will show in the mobile app. So to add charges in the NextGen Mobile app, a provider will select the appropriate encounter from the patient profile. And then after selecting the new charge icon, the provider will see the screen that we have, the screenshot we have here. And that will allow them to search from the practice's service item, that SIN library. They can see all the codes available to be selected. They also have the option to use what's called the quick picks section. So this is going to show charges that were previously selected for a patient. So if this is, charges have already been entered, they can quickly, add those to this encounter as well. If a provider does need to add charges for multiple dates of service at one time, they can repeat this process by clicking that date of service field up at the top of the screen, and they can choose a new date and just continue to repeat until they've entered all the charges they need to. So kind of going hand in hand with charge capture, providers can also utilize the mobile app to view and enter diagnosis codes for patients. So NextGen Mobile has the ability to incorporate the IMO platform. That's going to allow for searching and adding of diagnosis codes to the patient's chart. So if you're not familiar, if your practice doesn't currently use this, IMO is a diagnosis code search engine that can be used within the EHR. And I will say it's pretty smart, it's pretty user-friendly, so that makes it pretty simple to find diagnosis codes here within the mobile app. So the user would start by clicking that DX icon at the bottom of the patient profile, and then they can, from there, they can view, edit, add diagnosis codes associated with patient encounters. So a new diagnosis code can be added. So as I mentioned, you'd select that appropriate encounter from the patient profile, click that diagnosis code icon, And then from this window, a provider can search. Again, this is using the IMO search, and it's going to use kind of the same workflow as you would in the EHR. So they can use a keyword. If they can even enter the ICD-10 code if they know it. They can also choose from a list of previous diagnosis codes for this particular patient, as well as a list of commonly used codes. So it just kind of depends on what they're looking for this particular encounter. Similar to like what we see in the EHR, if a more generic keyword is searched, or even an ICD-10 code, that just requires a little more specificity. A decision tree will be displayed for the provider, and then they can go through those options to narrow down to find that appropriate diagnosis code. So as I mentioned, in addition to adding those new codes, the mobile application will also be able to be used to remove a previously entered diagnosis code. So provider would locate that code from the list that needs to be removed. They would start by selecting the encounter from the patient profile. Then under that list, again, depending on the device that the user is using, for any iOS devices, they would swipe to the left to see that delete option. And for Android, they would press and hold, and then it would just prompt to say, yes, I'd like to delete this diagnosis code. So the final set of NextGen Mobile features that we're going to review today are the dictation options that are available in this platform. So these dictation options can kind of just build on everything that we've gone over so far and really allow for additional documentation, some more discrete data, as well as some more of that clinical text data as well. So the current options available, you can see listed here, are speech to text, transcription, remote scribe, live virtual scribe, and then direct to desktop. So these options are all part of that Mobile Plus tier, and some do have an additional per transaction or per hour cost. So let's take a little more in depth at each of these options and how they could kind of incorporate into your practice workflow in different ways. So the first option is speech to text. So this is going to allow the use of the mobile device to act kind of as the microphone to dictate into a template that will then go into the patient's chart. So with speech to text, as a provider is dictating, they have the option to view that text real time, and they can actually go in and then make edits, and just kind of helps to eliminate some additional steps later. So typos, or if they want to add or remove information, they can kind of do that while they're dictating. When the provider starts a dictation, they're going to click that microphone icon from the patient profile. And then from that window, a pop-up will show to allow them to select the corresponding visit type. So these are selected based on some common ones like chart note, a procedure note, a telephone call, and that will kind of help to determine the prompts that are given, and then ultimately the template that this will live on within the EHR. So to kind of quickly dial into a particular area of the visit that the provider needs to add notes to, there is a feature at the bottom half of that screen called tags, and a provider can click on each of those tags and they can dictate for that particular area. For example, in the screenshot, we can see here we have things like the HPI, the physical exam, review of systems, particular diagnosis codes if those were added previously. And then once that dictation is complete, the provider will select the Send to EHR option, and then that information will all flow into a dictation template that's added to the patient's chart. And then the visit note will generate from that. Another option for dictation within the NextGen Mobile app is the use of a transcription service. So that is going to be a little different than our speech to text, and that's going to take those dictated clinical details, and those will be transcribed into the appropriate template patient's chart in the EHR. So the recording process would be similar to speech to text. So the main difference here is once that recording is completed, the provider will select Send to Transcription. That's going to send a copy of the recording and the speech recognition draft to a transcriptionist. They're going to review that draft, make any edits, really just for clarity purposes as needed. And then that clinical data is uploaded to a dictation template in the EHR, and the visit note is generated. The provider would then have a chance to review the note and sign off on it, just like they would, any other visit note. So this is really a great option, if you have providers that are high volume, maybe not as tech savvy. It does require a little tech, to use the mobile app, but really if they can navigate to that, patient's chart and select that, microphone option, they can just click, hit record and then send that to transcription. The typical turnaround time for transcription services with mobile is 24 hours. And as I mentioned earlier, this is part of the Mobile Plus subscription, and this is charged per line of dictation. So to build kind of even more from those dictation options that we've already reviewed, there are also 2 scribe options available to kind of go hand in hand with mobile. The first is remote scribe. So with remote scribe, the provider dictates their note into the mobile app, and then it gets sent to a remote scribe who takes that recording and documents that, into the free text, but also discrete data from the visit into the appropriate EHR template. The provider will then have the chance to review that completed document, sign off on that generated visit note. So it's kind of similar, but we have the option to put discrete data and text into different templates. The expected turnaround time for remote scribe is 12 hours. And this is a feature that is also, billed separately with that Mobile Plus subscription and is charged per minute of audio. If a practice prefers a live scribe, to allow that provider to kind of interact real time, there is the live virtual scribe functionality. This is kind of a unique service, in my opinion. It allows the practice to have a live person to complete the documentation on the provider's behalf, but this doesn't have to be a full-time staff member. It's kind of like a rent a scribe. You can use it when you need it. So with this option, a professional scribe will join the patient's visit virtually. And they will be documenting real time actually within your EHR. And the clinical staff and provider, can complete their exam as normal. And as with all of their options, once that visit is complete, the documentation will be available and the provider can sign off on that generated note. So, really get the final say on what was documented. So this is, again, part of the Mobile Plus tier, and this is charged by the hour for the live visit. So the final dictation option is kind of a newer addition to the Mobile Plus suite, and that is direct to desktop. Direct to desktop, it's similar to our speech to text in the fact that it allows for a mobile device to be used at that microphone. But a really cool feature with this option is that dictation will flow directly into any text box within the NextGen EHR application. So it doesn't matter if it's a template, a pop-up window, a clinical task. Really, if it's a place where a provider could have historically used a keyboard to type into the EHR, this direct to desktop feature can be used to dictate. So I think this is pretty neat because it really eliminates third-party dictation softwares. A lot of groups currently use Dragon, but this way, you don't have to have a separate integration. You don't have to have a separate extra equipment. It's just the use of their phone, tablet, things like that. So to use this, the direct to desktop app would be installed on the desktop that would be used alongside the mobile app. From there, the provider would just click in the box that requires dictation. From this screenshot we can see here, they would click that direct to desktop button and they can really just start talking. It's going to flow real time into the EHR, and then it can be edited as needed. There is also the option for what's called the open speech box with direct to desktop. And that allows for the provider to just continuously be clicking throughout the chart. So, maybe looking at past lab results, notes, really anything, and continue to dictate. And then at the end, they would copy and paste that into the appropriate places in the chart. And finally, to make it even easier, stored phrases, which are called macros, can be used to quickly insert common text, for example, like a normal adult physical exam. So that can be saved and quickly added and just make it that much easier. So here's an example of where you can see. So on the left-hand side, we have, as a provider, I'd have open my AP details. I click in that patient plan box. On the right, I have my mobile device. I clicked that direct to desktop and just started talking. It's going to start to flow that data in there. And then if I need to take a break or pause or move to a different field, I can click that tap to pause or close out when I'm finished with my dictation. So as you can see, there's really a variety of dictation options, just kind of depending on your practice's needs. So before we conclude our webinar today and get to questions, I know we're getting close to time, I just want to quickly review the NextGen Mobile Cloud Portal. So this mobile cloud portal is a website, and this allows your practice to easily create and manage your NextGen Mobile users. You can also run some reports from here on your staff mobile app usage. It allows you to create groups similar to what we see in like system admin for permissions within the application. And if you use mobile for dictation, you can also monitor and then troubleshoot any dictation issues from this cloud portal website. Okay, so hopefully throughout this webinar, you've learned some new options with NextGen Mobile that can benefit your clinical staff, make it easier to stay a little connected, and then help them do what they do best, and that's treat their patients. So before we wrap up and go over any questions you may have submitted, I did just want to quickly go over some next steps. So you can visit us at any time at our website, dishealth.com. Sign up for future webinars. I just want to quickly post this here so you can see some additional solutions that we offer. We would love to really help you in any way that we can. And quickly, before we get to questions, I did want to turn it over to Kyle Monette, and he's going to go over some of our cyber options.
Thank you so much, and great job there. It's hard to believe how far these systems and the EHRs have come over the last 10 or 15 years from when I first started. Yeah, my name is Kyle Monette. I'm the Senior VP of Technology at DAS, and I just wanted to piggyback on top of this and make everybody aware that DAS is a full-service managed security service provider. We can meet any and all cybersecurity needs that you may or may not have. We also provide managed IT services. But if you already have that inside, we can be a third-party cybersecurity firm that can come in and provide security risk assessment, security awareness training, and many other services that are really compliance requirements out there in the industry with your partners and your cybersecurity insurance policies and things of that nature. One specific situation I wanted to bring up that we're seeing in the marketplace, particularly with NextGen clients that are operating from a remote desktop or Citrix environment, is a big push and requirement to have multi-factor authentication to be able to log into those RDP and remote desktop environments, even if you're going across a VPN. So we're seeing major pushback from cybersecurity insurance and other compliance entities that this needs to be in place. DAS does have a very cost-effective solution to that we have fine-tuned specifically for our NextGen client base. In addition to being very reasonable and competitive in the marketplace from a pricing standpoint, our implementation timeline is extremely fast and not very disruptive. We recently deployed a practice that had 3,000 users in under 30 days. They were under a very, very strict deadline, and we were able to deploy that to all users out there in the marketplace so that they can meet their requirements. So without taking up too much time, because I'm sure you have a lot of questions for Lexi and the team, if you have any concerns or questions, or if you're hearing about do we need MFA, or if you're hearing about additional cybersecurity services like 24/7 SOC services or anything around those needs, please reach out to your account manager here at DAS, and we'd be happy to come on and do a security assessment or address any direct questions for you and talk about any kind of possible solutions where we can chime in. With that, I'll turn it back over to you guys for questions.
All right, thank you, Kyle. Here's just a quick overview of what he was just reviewing with our services. Again, when you get the slide deck, you'll have this information, and don't hesitate to reach out if there's any way that we can help you. All right, with that being said, we'll go over the questions that we've received so far. If you have any additional ones, just keep adding them in the chat. And again, this will be recorded and the slides will be sent out within the next week. You'll also see my information listed here. So feel free to reach out if you think of additional questions after the fact or would like to hear anything more. So with that, I will go ahead and jump into the question. So let's see, the first question that I see is asking, where is the PDMP? Assuming this was when we were talking about the e-prescribing controlled substances option, and I mentioned that there's the option to check that PDMP while prescribing. So within the mobile app, when you're on that screen to actually prescribe the medication, if it is a controlled substance, there will be a button, a link that says View PDMP. So again, that will just appear there when it is a controlled substance. You can go ahead and click on that. It will run through, display the report, similar to like it would in the EHR, and they can view that report, if it's applicable to the prescription. That's a great question. Let's see, the next question we have, so when replying to a communication, does it go into the communication template? So I'm assuming that maybe with the communication template, if you're referring to dictation, as far as I mentioned, you have the ability for speech text into the telephone call. That would then go into either the telephone call template or the communication template within the patient's chart in the EHR if you're documenting a telephone call that took place or a communication that took place. On the flip side, and you can clarify if I relating to messages. Okay, I was literally just about to say, if you're talking about messages, then yes, so that would flow in when you are responding to that communication. Yes, it would be available in that telephone call or the communication template that you use. So yeah, thank you. I appreciate you clarifying that. Next question, do you have to pay for IMO in order to use the diagnosis code option in Mobile Plus? So you do not have to pay specifically for IMO. So that is it's not a separate payment. Diagnosis code option, that is part of the Mobile Plus tier. So you do have to have a Mobile Plus subscription, but there's not an additional fee on top of that for IMO. That's a really great question. Let's see, the next question we have then is, it says, how do I sign in? And this was towards the end. So again, if you're still on and you want to clarify if this is what you're referring to, I believe they're talking about the mobile cloud portal that I mentioned. So it was about the time when we were going over that. So the login and the credentials for that is something that will be set up during your onboarding process. We can have you set up as the admins for that portal and anyone else who needs to access that to kind of maintain your users. And then you can use that to then create additional credentials for the Mobile Plus application for the providers that need to be using that. So again, if you are still on in that, I believe that's the section you were referring to, but if not, you can chime in. And that, I believe that looks like that's all the messages or the questions, excuse me, that we've received so far. If there's any that you think of after the fact, you have my information here. You'll be receiving the slide deck and the recording, and I'd be happy to help you answer any questions or clarify anything. But otherwise, that is all that we have for today. I really appreciate you all joining, and I hope you have a good rest of your day.